E.D. Mangan of Rogue Health and Fitness is an author and scientist focused on using pharmacology, biochemistry, and microbiology to better understand how diet and exercise can be used for anti-aging and longevity. In his 50s, by changing his diet, exercise, and other lifestyle habits, he transformed his health. He has written 6 books on health and nutrition, including Dumping Iron and Muscle Up, and recently published a paper entitled Iron, an Underrated Factor in Aging. With that, let me start the interview. Hi, Dennis. Welcome to Modern Healthspan, and thank you so much for joining us today.
Thanks a lot, Richard. Thanks for inviting me. It's a pleasure to be here.
Okay. So can you provide some background about yourself, and in particular, what led you to kind of research anti-aging?
Well, anti-aging in particular is something I've been interested in for a long time. I suppose, the background, the deeper background goes a little further. I studied microbiology at university and pharmacology, and have pretty much always been interested in health and fitness. So it kind of, led naturally to studying aging, way back when I first, decades ago, I suppose, when I first heard the idea that aging was malleable, that you could do something about it, I was very interested. So, attention, at the time, I'm still very much into health and fitness. I try to eat right, I work out and so on. I was doing the same thing back then, although in a very different way. So, this caught my attention, and I thought, well, if there's something that I can do about it, then I should learn about it and try to implement if possible.
Right. So a little bit on the health and fitness. Can you talk a little bit about how you kind of changed your view on what was the best health and fitness?
Yes. So, that kind of gets into some, fairly deep territory here, because it's really all about what I am, what I talk about on my website and on Twitter and so on. My overall view is so much of what they tell us in the mainstream views on health and fitness and nutrition and so on is wrong. And I believe there's a much better way. So how my views have changed. So like I was telling you about when I first read something way back when about aging, I was a vegetarian and I was a distance runner, because I thought that's what you should do to have a long, healthy life, right? So, the thing about, saturated fat and meat, clogs your arteries, causes heart disease, all this kind of thing. I believed that because that's what everybody was saying. And, by everybody, I mean, more or less mainstream news outlets and messages from on high from the government and so on. They were saying eat low fat and et cetera, eat your fruits and vegetables. And then the running thing also, I got into running a long time ago, and because I wanted to be fit, and I started doing it, and then I liked it, and I started running longer and longer distances. I've run a couple of marathons in my life, and but then I came to realize, for very personal reasons, really, because I became sick, that this was not the way to go. And started looking into it myself, and looking more at original sources, the scientific and medical literature. And what I discovered in very short order was that in terms of health and fitness, from the mainstream media, which is the only source most people know, they read news articles or something about some new finding, whatever, what is presented to us is often wildly exaggerated, or so off kilter as to be misinformation. and that the actual scientific and medical literature often does not say what the mainstream media would have you believe. I'll give you an example. Eating meat. So, like I said, we've had this message for a long time, not to eat meat or not to eat too much meat or whatever. And when you look at the studies that they're basing this advice on, there are so many flaws in them. They are largely epidemiological studies, which cannot show cause and effect. And not only that, the effects they have found are typically incredibly weak. So, for example, meat and colon cancer. So they do an epidemiological study. They find that people who eat a lot of meat have a higher incidence of colon cancer. But then you look at it, how much higher? Well, it's tiny, really. And then you get into things like healthy user bias. People who do not eat a lot of meat are generally health conscious people, because that's been the health message for so many years. And so these people are healthier to begin with. People who have typically eaten a lot of meat over the last few decades are people who say, well, I don't care, I'm going to do it anyway. And they're more likely to be overweight, to exercise less, to smoke, to drink a lot more, all this kind of stuff. So, and then you find things like, what is the lifetime incidence of colon cancer? Well, the odds of anyone getting colon cancer in their lifetime are under 5%. So if they find, for example, just to use a number, 4.5%, something like that. If the odds from eating a lot of meat increase by 10%, even if you accept that, which I don't for the reasons that I've just given, then the risk increases to 4.95% lifetime odds. Whereas then you look at things like visceral obesity and metabolic syndrome, they come with a threefold increase in risk of colon cancer. It's huge. It dwarfs anything that they found in these just weak epidemiological studies. So when I started figuring out those things, I figured, would it be too much to say we're being lied to? It depends on how you want to view the situation. A couple of years ago, there was a group of scientists and physicians investigated the whole meat and health connection, right? And this was published in Annals of Internal Medicine in the United States. And they came to the conclusion, after looking at all the evidence, that basically it was, reiterating what I just said. The evidence is incredibly weak, that it's so weak, it cannot be the basis of making any decisions about it. And if you want to eat meat, just go right ahead. There's no problem with it. And this publication was denounced, vehemently by the health and nutritional establishment in the United States. Many of them were trying to get it pulled before publication. And I'm talking about the heavyweights in this field in the United States. Walter Willett, for example, is a well-known name. That they said, oh, this is terrible, you can't publish this, and so on. And the authors were denounced in the press and in these various publications and in social media and so on. So this is a kind of thing. This is just maybe one example or a microcosm of the sort of things I found when I really started looking more closely at the scientific and medical literature. So that's my approach. In health, in diet and nutrition, I believe the mainstream has got so many things wrong. In terms of exercise, they don't recommend the best exercise there is, which is resistance training. They tell you to avoid the sun. This is another thing that dermatologists and other doctors have been telling people for the last I don't know, 40 years or so. Don't go out in the sun, you'll get skin cancer. Well, oh, gee, it turns out that the sun produces vitamin D in our skin, and now everybody's vitamin D deficient. And then we have things like viral pandemics going on. And so, and of course, vitamin D has been linked to so many other health conditions, cancer and heart disease and diabetes and so on. So the kind of, overall, I'm going on at length here, I realize, but overall, so much of the advice that we've heard is wrong, and there is a better way, and that is my overall view on health and fitness.